The following vlog reflects best practices in a medical setting, where the deaf patient receives information directly from the healthcare provider. The people in the vlogs are actors, and the scenarios have been created as an educational tool.
Hello.
Hello.
What brings you in today?
Well, this is my new boyfriend, Robert, and he told me that there might be some ways I can protect myself from HIV.
Let me know if you prefer to talk to the doctor in private, Carla, and I can step out.
No, stay. I'll let you know if I feel uncomfortable.
All right.
Nice to meet you, Robert.
Nice to meet you.
So, Carla, tell me more about what you need to know.
Well, Robert is HIV positive, and I'm negative, and we would like to start a sexual relationship. He told me he's undetectable and on medication, and that there is something called PrEP that I could take.
Okay. So you want to have sex, and you want to be sure that you protect yourself from HIV.
Exactly.
We can definitely talk about how to have a healthy sexual relationship today, okay?
Okay, thanks.
Have you ever heard of PrEP before? Are you familiar with that medication?
Not before Robert told me about it.
Okay. Well, first off, PrEP is for HIV negative people. Have you ever had an HIV test before?
I'm not sure.
That's okay. I'll take a look at your chart. Just so you know, people who are on PrEP have to have an HIV test every 3 months.
So how effective is it?
Actually, studies show that PrEP is very effective for both women and men. For oral sex, anal sex, and vaginal sex. We believe that anyone who has unprotected sex, who shares needles, or is dating anyone who is an HIV positive person could benefit from PrEP.
Yeah, that makes sense.
First, remember it's only effective for HIV. It does not prevent pregnancy or protect you or Robert from other STDs like gonorrhea or syphilis. Just like birth control pills protect against pregnancy, but not against HIV or other STDs.
Huh.
Okay.
So, it's important to use a condom when using PrEP.
How well does it prevent HIV?
That depends on how often you take the pill. What's interesting is we have more data on how it works for anal tissue and not so much for vaginal tissue.
Huh.
So we tell women to take it every day. It's better than 90% effective at preventing HIV.
Really? So I'd have to take it every day?
Yes, the best recommendation is to take the medication daily, like you might take a vitamin or blood pressure medication.
So PrEP is a pill? Or are there other ways to take it?
Yes, right now it is only a pill, but in the future there'll be other ways to take PrEP.
Okay. Well, there's got to be some side effects or long-term effects on my body, right? I mean, something that I take that frequently must take a toll.
PrEP is very safe. No serious problems have been reported in the people who are taking PrEP. PrEP may cause side effects like headaches, nausea, loss of appetite. These side effects aren't dangerous, and they get better with time once your body gets used to PrEP. If you have any side effects that bother you and don't go away, come see me. I'll help you figure out to be sure that everything's okay.
Okay, thanks.
Sometimes PrEP can affect kidney problems, so we'll check your creatinine today as well.
Okay.
I also think we should check for other STDs today since you're already here. So there will be 3 blood tests.
Okay, that's fine.
If the HIV test is negative, I will send a prescription to your pharmacy, and that will take about 3 to 4 days.
Okay. But wait, how much does this medication cost?
PrEP is an expensive medication, but don't worry. We have plans to help people get the medication at a very low cost. Fortunately, most insurance plans now cover PrEP. And the pharmaceutical company that makes PrEP, Gilead, also has a copay program to help reduce the costs.
Huh.
This sounds really confusing.
Yeah, I know.
Since you live in Massachusetts, you would also qualify for a Department of Public Health program called PrEP-DAP, which stands for PrEP Drug Assistance Program. PrEP-DAP can help you cover copays. They usually approve our applications within a few days, and then the financial assistance will kick in. And that should make it much more affordable.
If we go ahead with the prescription, would you help us fill out those applications?
I'm happy to say we have a very knowledgeable PrEP navigator in-house who can help you with all of this today. After we finish this visit and you get your blood drawn, then I'll introduce you to Jorge, who is our resident expert with financial assistance. He can help you with all of it.
Oh, good.
That's great.
Okay.
Any more questions?
I have one. Is that okay?
Yeah, go for it.
Of course. What is it?
I have a friend who lives out of state who is considering going on PrEP. How would that happen?
I would suggest they make an appointment with their primary care provider and ask how to get PrEP. They can also go online and look up a PrEP navigator, such as preplocator.org, through the CDC or at their state's Department of Public Health.
Oh, okay. Thanks.
Would you like to get started with the blood tests now?
I would like to do the blood test to start.
All right.
Thank you for all the information, doctor.
No problem.
Thank you so much.
You're welcome.
If you'd like to learn more about PrEP, visit these websites.